Hi, I'm Dr. Serena Satcher, and this is Breast Cancer Awareness Month. And I want to talk about iodine and hypothyroidism and where the cross section is between breast cancer risk and low thyroid and iodine. So, iodine is one of the halogen family, and it plays a role in healthy breast tissue. You never hear about it in conventional medicine, and I had breast cancer, and no one ever mentioned it to me. I already knew about it, and I was already on top of my iodine levels. But iodine for the breast tissue uses the same ion transporter as iodine for the thyroid gland. It's an antioxidant, it's anti-inflammatory. Many believe that it's antimicrobial, and it's also anti-proliferative effects that it has in the breast tissue. So many believe, because of animal studies, that if the woman has an iodine deficient diet, that breast tissue can become more sensitive to estrogen. And this causes an increase in cell proliferation, and that can lead to precancerous or cancerous changes within the breast tissue. So, with fibrocystic breast disease, that's a breast disease when there are lumps and bumps in the breast. So, if you have lumpy, bumpy breast, that's called fibrocystic breast disease. And it's a condition of benign lumps and breast tenderness. And some studies suggest that fibrocystic breast is associated with an increased risk of developing breast cancer. And fibrocystic breast can result from low iodine levels. And you never hear about this. You never hear about iodine talked about in conventional medicine, but iodine is very important in our bodies. And there are other glands that are sensitive to iodine, like for men, the prostate, and also the pancreas. Um, and many people believe from animal studies that all the endocrine glands may be sensitive to iodine as well. So, in recent times in the United States, the overall iodine intake has decreased in the US population. And this could be because of a reduction in household use of iodized salt and less iodine in the food supply. But the iodine in the salts may not be natural iodine. It may be some that's been synthesized in the manufacturing of the salt and then added back to the salt. Natural sea salt has some iodine in it. And then also naturally harvested salt. Like I've seen salt from Syria that has a high sulfur content that's red, and it has some iodine in it. There's also iodine in seafood. There's iodine in uh, sea kelp, and there's iodine in seaweed. So there are natural sources of iodine. There's also iodine in animal liver, like in beef liver, turkey liver. So there are ways to get iodine other than taking straight iodine, but taking straight iodine is also an option. And you can find out from your doctor if you're willing to pay for the test because insurance is not going to pay for it. You can get an iodine level either in your blood or in your urine. The urine, of course, is easier to collect. Don't need to have a blood draw for that. And they can just get a random urine iodine. Okay. So tune back in. I'm going to talk about the thyroid and iodine next.